Right-sided heart failure is a condition in which the right side of the heart, responsible for pumping deoxygenated blood to the lungs, fails to pump blood forward to meet the body's demands. This results from structural and functional changes to the right side of the heart that causes systolic or diastolic dysfunction. A systolic dysfunction is when the heart has trouble pumping blood, while a diastolic dysfunction is when the heart has trouble filling with blood. Whether the cause is systolic or diastolic, the result is the same. Less blood is pumped forward, causing blood to back up into the systemic venous circulation. Right-sided heart failure is most commonly caused by increased afterload, or the resistance the right ventricle or atrium must work against to eject blood. Afterload can increase chronically or acutely due to various conditions, most commonly being pulmonary hypertension caused by left-sided heart failure, but also pulmonic valve stenosis, tricuspid valve regurgitation or stenosis, and left-to-right heart shunts. Different changes occur in the structure and function of the heart based on the speed at which afterload increases. If afterload increases chronically, compensatory mechanisms cause hypertrophy or thickening of the right ventricle or atria's walls, which initially is an effective adaptation. However, eventually it causes a reduction in the chamber size and compliance or ability to stretch. This reduces the volume of blood it holds, causing a diastolic dysfunction. As hypertrophy progresses, the coronary arteries can become compressed, blocking blood flow and causing myocardial ischemia. This weakens the muscle, causing a systolic dysfunction. Coronary artery disease and myocardial infarction can also cause right-sided heart failure because of ischemia. And in contrast, if afterload increases acutely, it can cause dilation of the right ventricle or atria's walls. This causes the muscle to become weak, resulting in a systolic dysfunction. If you want to learn more about any of the conditions mentioned, you can click the link on screen or in the description below. The first signs and symptoms of right-sided heart failure generally include shortness of breath with or without an increase in work or breathing, decreased exercise tolerance, hypoxemia, chest discomfort or pain, palpitations, and peripheral edema. As the condition progresses, blood backing up into the systemic venous circulation worsens. This causes jugular vein distension, anasarca or extreme generalized edema, ascites or abdominal edema, and hepatic congestion, causing hepatomegaly or enlargement of the liver. Hepatic congestion can cause liver injury, leading to liver cirrhosis and failure. Late signs and symptoms of right-sided heart failure include tachycardia, cool extremities, delayed cap refill, cachexia or unintentional weight loss, syncope, hypotension, and inadequate end organ perfusion that can lead to organ damage and failure. Diagnosis of right-sided heart failure generally includes a history and physical exam, blood work with cardiac-specific labs, such as troponin and B-type natriuretic peptide or BNP, imaging such as an X-ray, CT, or MRI scan, echocardiogram, ECG, and right heart catheterization. Additional diagnostic tests may be required to identify the underlying cause. Right-sided heart failure treatment focuses on treating the underlying cause, reducing afterload, optimizing contractility and volume status, and managing undesirable compensatory mechanisms. The method of reducing afterload is cause-dependent. Pulmonary vasodilating agents, such as calcium channel blockers, phosphodiesterase type 5 inhibitors, prostacyclin analogs, and endothelin-1 receptor antagonists are used for some forms of pulmonary hypertension, where a surgery may be required to reduce increased afterload caused by heart valve disease and left-to-right heart shunts. Optimizing contractility is achieved using medications with positive inotropic effects, or those that increase the force of the heart's contraction, such as digoxin in mild cases and milrinone and dobutamine in severe cases. Norepinephrine, a vasopressor, may be needed to maintain blood pressure alongside milrinone and dobutamine, as they have vasodilating properties. Fluid volume optimization with right-sided heart failure is individualized, but generally the aim is euvolemia, or a normal fluid volume. Individuals may require additional fluids or fluids to be removed, in which case fluid restrictions, medications such as diuretics, or hemodialysis for those with impaired renal function may be necessary. A low-sodium diet may also be recommended to reduce fluid retention. Fluid volume status can be monitored by measuring central venous pressure and tracking fluid intake, output, and daily weights. In certain cases, beta blockers, ACE inhibitors, An angiotensin II receptor antagonist may be useful to counteract undesirable compensatory mechanisms, such as tachycardia and fluid retention. A right ventricular assist device, heart, lung, or combination transplant may be required as a last resort. If you want to learn more about any of the medications mentioned, you can click the link on screen or in the description below. There is also a special consideration when caring for individuals with right-sided heart failure on a mechanical ventilator. During mechanical ventilation, positive end expiratory pressure, or PEEP, increases pulmonary arterial pressure and reduces venous return. However, adequate PEEP is necessary to avoid hypoxemia and hypercapnia, which can cause vasoconstriction of the pulmonary arterioles, increasing afterload. Therefore, an appropriate balance must be found, as both too much or too little PEEP can worsen the condition. It's not always possible to prevent right-sided heart failure, as it depends on the underlying cause. However, following recommended treatments, maintaining a healthy weight, and quitting smoking can slow the progression. I hope you found this video useful, and if you did, please let me know by giving this video a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!